Stem Cells 102, Frequently Asked Questions Part 2. This presentation was prepared by Dr. Max McLeod, D.O., N.D., Ph.D. for the Age Reversal Technology Center. Contact us to learn about our unique approach to using stem cells as part of our Wolverine healing protocol. Doc Max is also known as the Nutrition Ninja Doc. He's devoted over 5 decades to studying health and health optimization while being in clinical practice since 1979. He has 3 postgraduate degrees in the health sciences and is a contrarian, always looking for better ways to help people overcome their health challenges and achieve their health goals. He has over 30 years of experience doing regenerative injection therapies and has added stem cells to this over the past several years. First question, are stem cells safe? That depends on who you ask and who you believe. The FDA, which is considered by many in the public sector to be the arbiter of truth, has been shown to both be very wrong on many things and to be a captured agency that is controlled by Big Pharma. They are the main ones sounding an alarm to be cautious about using stem cells, although they also state on their website the following. The facts: stem cell therapies may offer the potential to treat diseases or conditions for which few treatments exist. Sometimes called the body's master cells, stem cells are the cells that develop into blood, brain, bones, and all of the body's organs. They have the potential to repair, restore, replace, and regenerate cells, and could possibly be used to treat many medical conditions and diseases. But the U.S. Food and Drug Administration is concerned that some patients seeking cures and remedies are vulnerable to stem cell treatments that are illegal and potentially harmful. And the FDA is increasing its oversight and enforcement to protect people from dishonest and unscrupulous stem cell clinics, while continuing to encourage innovation so that the medical industry can properly harness the potential of stem cell products. If you ask the thousands of doctors and researchers familiar with this field and their use, the resounding answer would be yes. They are both safe and more effective than virtually anything that modern medicine has to offer for a wide range of conditions. However, since they are not specifically approved and blessed by the FDA, and more importantly by Big Pharma, it will be many years if not decades before they become recognized as the standard of care. There have been over 74,000 published studies demonstrating their safety and effectiveness. Various types of stem cell procedures have been used successfully for over 65 years. There have been a handful of issues and negative outcomes when used improperly, mainly with bone marrow or fat-derived stem cells, but not with umbilical-derived stems. Please note that adverse drug reactions from properly prescribed and properly administered medications account for over 100,000 deaths in the U.S. alone each year. These are drugs that have been approved by the FDA. So, when making your own mind up about whether stem cells are safe, be sure to take that information into account. Next question, what is the best source of stem cells? No one can say with absolute certainty. However, all of the evidence and data point to umbilical cord-derived stem cells as being the safest, most effective, and therefore the best source of stem cells. Next question, why isn't stem cell therapy used more? It is very, very simple and quite sad. Stem cells simply do not fit the current medical financial system. They are not drugs, they cannot be patented, although Big Pharma is trying to do so, and most importantly, Big Pharma has not been able to figure out how to capitalize on their use. Last question on this video, is stem cell therapy covered by Medicare and insurance, and if not, why not? Seriously? When did Medicare or so-called health insurance ever pay for anything progressive or regenerative that it wasn't forced to pay for? They don't, and they are not likely to for at least a decade or two. Hopefully, by then we will have a much more effective healthcare system, whereas today we only have an extremely ineffective disease care system. In my opinion, most of the problem has to do with people choosing to let insurance companies dictate their healthcare options versus taking responsibility for their own health and well-being. Health insurance is like betting against yourself. It fosters a system whereby people shift the responsibility and burden of self-care to the insurance industry and physicians paid mostly by the insurance industry. Think about it, doctors that rely on the insurance industry to pay them the lion's share for patient care have 2 masters and you are not the primary. We invite you to learn more about our innovative approaches to helping you optimize your health. Check out our website at ARTC Health. Subscribe to our newsletter to receive future updates, or call us to schedule a consultation. ARTC.Health. Doc at ARTC.Health. or call 941-806-5511. ARTC.Health, 941-806-5511. Doc at ARTC.Health.